every day we come in and it's different. Patients are different. We have different staff coming in and helping us. So it's been like a shock almost how much has changed.
Adapting is what Gilio and other frontline healthcare workers must do to respond to the ever-changing COVID-19 pandemic. They're getting their temperatures checked before they come into work and have to wear personal protective equipment all day.
It's hot. It's hard to breathe in. Nobody can hear you. We're in like rooms with the doors closed, so you're trying to shout through like the window to people what you need. And they get like your jaw starts to get sore, your nose gets sore, and this is much less like pressure on your face than the respirators.
Gilio is referring to these 3M P100 respirators that Edward provides because they can use them repeatedly, unlike disposable N95 masks. To get through the communication barriers, nurses have come up with a creative solution.
We've got iPads that we've been using, and we can call into the room and talk to the patient from outside the room too, so that they can hear us better.
The other Pulmonary Medicine unit clinical leader, Juliet Blondis, said the unit has shifted its focus to help with the fight against coronavirus. The department has been helping out at the ICU since mid-March.
Initially, when we moved over here, it was scary for everybody. This is a whole new virus, and we're not really sure how to take care of these patients initially. So I think there was a lot of anxiety, and it's gotten a lot better.
Blondis credits Edward for improvements like a healing team, which provides staff with mental health resources.
It's a group of counselors from Linden Oaks Hospital that are here just to debrief staff, they can go in and just chat with them if they want. They can go in with a couple of their fellow nurses or techs and just talk about the anxieties they're having.
Jaderberg also said the hospital has a relaxation room if staff needs a minute just to decompress. Both healthcare workers said their personal lives haven't really changed, but admit not seeing their parents has been hard.
Obviously, my parents are old; they're in their 60s, but you don't want to pass anything on, so I haven't seen them.
My dad, I haven't been able to see him, and that's been really hard. And my other family, my sisters, keeping away, and like coming up Easter, it's like, we're not going to be doing anything. Just going to be staying home. So yeah, that's definitely been a challenge.
Though healthcare workers are fearful in the battle against COVID-19, there is a silver lining, and that's the outpouring of community support.
I feel like it's inspiring all of us every day to continue doing what we're doing. I mean, we haven't had to buy lunch, I don't think, at all for the last 3-4 weeks. Every day we get lunch delivered. People are sending cards. I just feel like the community support's overwhelming.
Like thank you notes from all the kids. Sorry, but it's really nice. Sorry. Our break room is like covered in stuff, and we keep getting more and more and more. So it means a lot. All the like kids and Girl Scout troops and school classes who aren't in school. There's just so many cards and thank yous. It's really nice.
Having firsthand experience battling COVID-19, Gilio says it's best for the community to stay home and safe during the pandemic.
We're all susceptible to this, and I see how sick you can get, and I really feel like none of us want to ever have to go through that.
Blondis says even though we are apart, we can still come together.
We just need to support each other and get through this hard time, and I know we will do that.
For Naperville News 17, I'm Christian Canizal.